Hello and welcome to another episode of the Beyond the Device podcast, where we explore the life-defining moments that shape careers within the medical device industry. We're particularly interested in understanding how personal experiences, challenges, or pivotal events influence professional journeys. As we progress through the conversation, we will eventually land on the question, what is the one defining moment or experience in your life that changed everything and set you on the path you're on today? Today's guest is Megha Iyer, a global leader in regulatory affairs with a wealth of experience across medical devices, diagnostics, and life sciences. She heads global strategic regulatory affairs at Thermo Fisher Scientific, where she drives regulatory strategy, intelligence, and policy development across the business. She also plays a leading role in shaping industry regulations through MedTech Europe, ABHI, and as a board director at RAPS. With a strong focus on mentoring the next generation of regulatory professionals, Megha brings both deep expertise and a passion for advancing the field. Welcome to Beyond the Device, and thank you for joining us to share your story.
Thank you very much. What a pleasure to be here. Thanks for having me.
Right, so what we'll do, we'll take it all the way back to the start. We're interested in learning sort of where your story started, tell us about your early years, and kind of what shaped you growing up.
Sure. Little Megha started in the city of Bombay, or now known as Mumbai in India. Born to a middle-class family, both parents, working. My dad is from science. My mom is from the humanities background. She's a teacher, and happy little life in Mumbai as the only kid. Right at school, just loving life in general. Very curious kid growing up as well, and quite a geeky one at that too.
And what were your aspirations as a child, as a teenager? Like, did you envisage doing what you currently do?
I didn't. So as a child, my geekiness came out in the form of reading a lot. And sometimes, as an only child with parents working, you kind of have to find your own companionship. And I found books. The book that changed my thinking about what I should do in life was Jurassic Park by Michael Crichton. Uh, my mind was blown. My little 8-year-old mind was totally blown, and of course I didn't understand the intricacies of the DNA mutation and what how they actually constructed the dinosaur, the science of it. But at that stage of my life I was obsessed with anything dinosaurs, and so reading this book started to open my eyes up to the possibilities of science and biotechnology that I didn't know existed. um, and when I watched the movie, it really put everything together for me as a child. And I knew I wanted to do something in science. If it had to do something with dinosaurs, that would be the best. But I knew I wanted to do something with genetics, DNA, its manipulation. So that gave me some really good pointers in terms of where I should start going next. Um, Funny enough, that prompted me to ask a lot of questions in my class to my teacher. And think of this scenario of being in India. I had 60 plus girls in my class with one form teacher. And the teacher's constant complaint to my mum at any teacher's meeting was, she asks a lot of questions. My mum didn't know what to do with that. My teachers didn't know what to do with that. I didn't know what to do with that. So somehow the message I started getting was, it's not good to ask questions. I grew up at the time in school before Google had arrived. Google only arrived when I was about finishing school. And so I didn't really have an outlet to going and asking further questions. So I just kept reading and reading and reading some more to the point of satisfaction. So yeah, I would say that kind of defined my early years, years in terms of starting to shape what I would eventually become.
And aside from Tyrannosaurus Rex, were there any other sort of key role models or people in your life at that point that kind of helped you along the path?
Definitely. So after I decided that I didn't want to study medicine, much to the chagrin of my dad, he thought with the growing interest in biology, I might naturally gravitate towards medicine, and I liked working with people. When you grow up as a kid in India, the time I did, you either became a lawyer, a doctor, an engineer. Those were the three career choices. If you were not that great, then you would think of one of the to become a chartered accountant or something like that. But the options were very limited in the way people thought about what their careers could do. So at the time, definitely my parents weren't my role model. I was trying to do everything that they were saying not to do. Um, as I grew up, I started going towards science and did science as a degree, studied microbiology because I was convinced that that takes me more towards genetic engineering and understanding the concepts of DNA and RNA and what that does. And I got a master's in biotechnology from India. While I was doing my master's, I had to submit a thesis to support my master's. And I worked under a gentleman, Dr. Vinay Kumar, at one of the leading industrial sort of labs in the country, national labs in the country. And at the same time, I was also doing an internship, volunteership really, under a leading physician who was studying the effect of some new HIV drugs that would prevent the crossing of the HIV virus through the placental barrier. And so I was doing these things simultaneously, and these two gentlemen were real role models. They shaped the way I was thinking and I was processing the information I got. And a really turning point incident for me at that juncture of my life was while I was assisting this physician with his clinical study, I noticed that the patients that we were interacting with, they were typically illiterate and lower income. And why I say that is because they were being explained the side effects of the drug and of the trial in extremely technical terms. I started to see I clocked the look of like bewilderment and puzzlement, and just being puzzled on their faces. And it felt like they weren't really clocking what was going on. Or maybe I was like quite sensitive to it at that time. And so I went to this doctor and I asked the question about what do we do when they don't understand it? Uh, and his response to that was, well, they're lucky enough to be in the trial because the socio-economic status that they represent and the choices they have in front of them, these trials prolong their life by a little bit and give them a better quality of life. And somehow that answer never sat right with me. I could understand and I could see what he was saying at the time, that this was better than no option at all, but it didn't sit right with me and I couldn't put a finger on it. And so at the time, I went to the books that I could. I couldn't find an answer in any of the books that I was reading. And then happened to speak to my then thesis guide, who was Dr. Vinay Kumar. And he said, my question was so interesting. And that just was like such an aha moment because it's the first time in life someone actually said, your question is valid and I'm glad you're asking it. And he said to me, what if this was your family that was, needing to take these drugs? What if they were put in the position to receive this treatment but didn't know what the side effects might be or didn't fully understand it? And he didn't really give me an answer, but he set me thinking some more. And so I would say in doing that, both these gentlemen were real role models in my life who helped me come to my aha moments when it started to matter.
It's really interesting that one of those role models, rather than answer your question, has praised the question and then asked you more questions in return. But that got you thinking in a certain way. So still no answers,
Yeah.
but it just shows the power and value of questions. So with those early role models and the path that you were then on, we want to center this conversation around a key defining moment or experience. So have you got one of those that you could share with us?
Absolutely. Uh, as I continued my career journey and came into regulatory affairs, and these are the incidences that started getting me to look into what the field of regulatory affairs is, what ethics is, and things like that. And as I started to get into it and started to be good at my job and enjoy it, there came a time where I started to volunteer for RAPs, whom I'm associated with for so many years. And I was always very satisfied with being in the background because I was in very early stages in my career, and I felt like that I was really lucky to even be there. That aha moment came, and it's still true for me today, where um one of my former mentors and lifelong friends, Nicole Landerville, she said, "You need to speak at RAPS." And so, for a kid who has had a journey of being said, don't speak up, don't ask your questions, where I've had one moment of saying, yes, the question was good, but here's someone saying, oh, you should speak up and you should do more of this work at RAPS, and people want to hear from you. That felt completely bonkers. I was thinking, what are you on about, Nicole? And she said, and I said, I don't have so much experience to really be able to advise what someone else should do. And she completely debunked that theory. She opened the doors to RAPS for me, and then so did Meg Musha a few years later, to increasingly important positions in RAPS, and which had a greater impact. And they both showed me the importance of pursuing opportunities, especially volunteership, outside of your mainstream work in a way that allows you to explore other talents, strengths, leadership skills that don't often come up in a work scenario. And for someone who is, very good with what they do at work and enjoy that, doing something on the outside can feel like a total distraction, sometimes like a waste of time. But these women showed me that there are so many avenues to growing your career as a person, that it's really important to look beyond the horse blinders, beyond the path that you're staring down, and widen your perspective. That still holds true for me. So even even through the growth of my career, whether it is the various positions within RAPS, then going into trade associations, starting to build that relationship in terms of influencing, providing expertise on regulations and upcoming regulations, they all started to open doors progressively to areas that I was blind to as my strengths. And perhaps just doing my work, my 9 to 5, as they call it, that wouldn't have exposed me to all of these different areas, and then finally culminating today in taking responsibility for advocacy and policy, and the development of the regulatory function within what I do as a day to day. So those have found a way to weave into my story today and hold true for me today.
I love that. I love how you can still remember your your parent teacher evenings being told that you asked so many questions, but now you're sort of leaning on that as a superpower because you've been around people that have helped you come out of your shell and actually work on that. And I'm guessing that has then influenced how you are with others that are coming through with the mentorship and stuff like that. But did you feel like when you were starting out in RAPS and getting involved, was there imposter syndrome? Was that because you said you felt lucky to be there? Was it a
Yes.
case of you feel like you didn't deserve to be there, or what was it?
Um, a lot of all of that. When women, and maybe it's true, and I say this for women, and as a person of color, very conscious of that, but it's also true for so many other people, where gratitude and humility is kind of thrust on you. You kind of need to wear that badge all the time, so that becomes part of your fabric. Uh, when you kind of come onto a global stage and you see different cultures and how they represent themselves and how they talk about their strengths and their ability to contribute and their need to advocate them for themselves to get to certain positions, certain cultures, and that's true of the British culture as well, right? We tend to self-deprecate. We tend to not talk about our achievements and our strengths in an obvious way, in a way that opens doors for us. We're very bashful about ourselves. And so that was an ingrained culture in me for the longest time. Um, it was more important to appear, to have gratitude, to be humble, than talk about what you might bring to the table. And and that's true in my case. So hearing these very conflicting, and you picked up on it, what was said to me in my childhood and as the culture I came from, and here are people saying, you need to speak up, you're probably good at some of this and you don't realize it. That caused a lot of confusion, and it took a little bit of navigating to find my own style of where I feel comfortable to talk about what I do and how I can do it well, versus the need to be that humble, that collaborative person who I am as well. So I have these multiple identities. It's a little difficult to juggle between those identities, but it's important to kind of recognize those times where what needs to come to the fore at the time, and imposter syndrome is part of it. Until you figure out what is your style, what feels comfortable, and you keep honing on it, I don't think there's any person who would say they never had imposter syndrome.
Yeah.
Everyone does. It's just about overcoming that and leading towards action and being okay with whatever that consequence looks like. That is something I had to learn.
Yeah.
It could come out imperfect, it could come out wonky some days, but excellence looks a little bit different on each day. And so that's something I've learned to embrace.
Yeah. And like anything, it just comes with practice. So in an environment of going to conferences or speaking on panels, I actually remember the first time that we met was at one of the early BIVDAs that we attended. And I think I sat behind you. And I did think even then, like, the lady in front of me is asking a lot of questions. Like, it kept putting her hand up. Thought I must talk to her after and introduce myself. And we've gone through that process with things like BIVDA. You know, you're sat around a lot of industry professionals that are representing their companies, and we are there as niche recruiters. And there were times in the first few that we'd go to where I had a question, but I wouldn't ask it. Why do I deserve to ask a question? And then at seminars, happily sticking my hand up. People know who I am by that point. So it just comes with time and practice and feeling comfortable in the environments that you're in,
Yeah, I think
and
that's one,
being
but
made to feel comfortable.
that's the important thing I was going to highlight. I think there's a lot of responsibility on those who also hold these forums to make it comfortable to ask those
Mm,
questions. Like my example at school, and here as well in my career, I've very distinctly picked up. I haven't been able to articulate it then, but I can see now where I haven't been made to feel comfortable because my question didn't sound right or didn't land in the way that felt right for people. It's not about being belligerent, it's not about being difficult or asking some of the barbed questions. I think all of us are, I want to say a majority of us, especially in the field of regulatory, we're scientists. We come from a background of wanting to understand how the science and works with the practice of regulation. So we're not really out to put someone on the spot. Yeah, some questions can be a little bit uncomfortable, but it's also the onus of the person who's hosting the forum to make it okay to ask the question, to moderate, to redirect, and to make it okay for people to speak up. So this is something really important for me, and I try and make it a practice across the hierarchy. Just focusing on what is the question and what are people trying to get at, and how can we take that question and make it in a way that there can be an answer to it.
yeah. And that takes a lot of self-awareness
Mm.
to feel one way about asking lots of questions to suddenly feeling very positive about it, and finding where you land in the middle. Um, and takes time and practice, as we said. But do you lean on anyone now for feedback, for example?
I do. I still like to get feedback on pieces that we've done together. I think that's really important to know what could be better next time, and more importantly, what went right, so we continue to keep the practices. So I'm still in touch with my mentors. I won't hesitate to ask people for feedback. I know that when you and I finish the call, I'll be asking you, how did that go? And was there anything that, did meet what you needed to do? And was there anything that you would change or do differently? I think that's so important. It's important to know whom to ask feedback from. It's important to know to ask when that feedback is necessary. It's also important to know, what does that feedback do to you? Do you agree with it? Sometimes a lot of imposter syndrome comes from too much feedback as well. Like, because people are very quick to give you the negatives of what didn't go right. Sometimes the positives take a little bit more time to come out, and there's a little bit more teasing out of that information that's required. And so sometimes that can be very overwhelming, and it's easy to take away a message that, so nothing was positive about that. But it's important for someone, and this has been my learning journey, to understand where the feedback is coming from, and to try and understand how to relate to that feedback. They're all data points at the end of the day. What data is valuable? What is significant? What is a pattern? If you look at it from that kind of an objective way, that can be a little bit easier to help overcome some of the imposter syndrome or some of the gaps that one sees in development. So to answer your question, I have a number of people who, I love to use that phrase, personal board of directors of my life that I will go to. I take feedback from my husband, who's lovely, who's a major support system in my life. I take feedback from my 9-year-old, who will tell me things as they are. I love that sense of honesty. I have mentors within my organization, outside my organization, and I spend time reflecting on what they said, and seeing the value in it, and how I might make small changes, but sustainable changes to help me be better to myself and to them as well.
But so you've obviously gone from a childhood where you're kind of told not to speak up, not to ask questions, and then you've got positive influences, colleagues that are telling you should do this, and you've obviously seen the benefit of doing it, but that won't come without its challenges. There'll be, what has been your emotional state, your emotional well-being at that time, because it's not a case of, you should go and talk there, because there's going to be a feeling that you feel at that point. What are those feelings, and then what have you done to kind of overcome them, to get the confidence to actually say, right, I'm going to do that thing? Because I think that's what people would like to hear.
Absolutely. I've had a lot of self-doubt. A lot of us do. I still have self-doubt from time to time. And sometimes that has resulted in inaction, not because I've not wanted to do something, but I felt held back by the fear of getting it wrong, the fear of messing it all up. In sort of an irrecoverable way. And a lot of this is self-inflicted. This is some of the stories that we tell ourselves, right? What if it all goes wrong? This is all very high stakes. Because I think it's only recent that we've started to understand about psychological safety, how it is okay to make mistakes. What do you do to recover from a mistake? These were not things that were ever taught at school level, at university level. You could go through like a really long academic career, a career at work, and not learn some of these things. And so you kind of, when you learn to be that sense of perfectionism, of only doing things right when they look perfect, or when you don't understand, or you don't see the process behind it, the making of something, or the behind the scenes, you don't know that it takes so many takes to get it right. And a lot of times I've held back myself from realizing my potential. I have silenced myself. I walked away from some of those meetings thinking, oh, it was me that didn't ask the right question. It was me that put someone out. It was me. And a lot, self-reflection is great, but sometimes, that prevents you from actually speaking up, from contributing meaningfully to something that can go forward. I can remember a number of small and big incidents where not speaking up has made me then go back and regret that I didn't give something meaningful to put into that pool of the discussion. And learning from that, I kind of felt like, what is it? Is it how I'm saying it? Is it what I'm saying? Is it whom I'm saying it to? So whenever I have to give some difficult messages that feels like it's going against the grain, I try to think about how am I going to tailor this message so actually I say what I want to say, but I do it in a way that feels collaborative, feels meaningful, feels thoughtful. And I use my time to mentor a number of colleagues in regulatory affairs, from entry level to director level, and to really help them. I want to say to craft their messages, to be able to speak up. The common thing in regulatory affairs is that we all tend to feel like we are, a supporting function, and we tend to take a back seat, and we tend to not speak up in areas that we don't feel like our voice belongs. So whether it's talking about the value proposition of, a new idea, a new business idea that the company is going to go for, it's talking in mergers and acquisitions, it's talking in, some HR strategies. You feel like, oh, we don't have the expertise. What, I don't need to say anything here, and we hold back. And my constant evolution is around how do we participate as a business enabler in those conversations, knowing that we're not necessarily the experts, but having the value and the objectivity to bring that comment to life and to add to that pool of that knowledge, and then letting it be there and letting the people that need to make meaning of it make of it and use it in a way that they see fit.
Yeah, so sort of what you said there is the fear of not being perfect has then sort of made you not take action in certain areas because of mistakes. If you think back your career, your personal life, think of the biggest mistake that you would classify, and was it actually as bad as you thought before it happened?
I've made a lot of mistakes, so I'm trying to think of what the biggest mistakes are. Yeah, I'd say that if I think through what I would classify in my mind as the big mistakes, it would sort of point to not speaking up when it mattered, not speaking up when it counted. It's then like, hindsight is an exact science, as they say. So it's about then watching something go completely derailed, and not saying something. I can give an example here. Um, when one of the projects I was working on, this is a long time ago in my career, and we were looking to present a study to the FDA as part of a pre-submission conversation. And I knew fully well that the study didn't have solid endpoints where that could make for a meaningful conversation with the FDA. I knew that if we went to the FDA and we spoke to them, it may be perceived as a waste of their time, because it's something that we should be filtering out before it reaches them, and and then they start to have a negative perception of us as a company. At the time, I had a manager who encouraged the not speaking up, and was one of those people where I didn't know how to navigate the situation. I didn't feel empowered enough in my role to say, this could be a negative consequence of going to the FDA with this particular study. The impact could be, their loss of confidence in us. We could end up, creating a negative first impression. This could have a knock-on effect further on in the development of this product. It's probably best, and my recommendation is to not take this to the FDA at this stage. At the time, I didn't have the support. I was early in my career. I didn't know how to navigate the situation. We went to the FDA. The conversation didn't go well. I felt like we tanked our reputation a little bit with them. And that didn't feel very comfortable when I walked away from it, knowing that I knew this and I anticipated it, but I didn't speak up. It's not about controlling the outcome. Whatever happened, it's still the business decision to choose whether to go to that conversation or not. But I didn't present my well-founded arguments or intuition in a way that felt like could help the decision making in whether it should have gone to the FDA in the first place or not. So I would say that's an example that I think of when I say what's the risk of not speaking up here.
Yeah. And I think when we look at your turning point and that being, people telling you should kind of do differently to what you've always done, it's a positive turning point and then has led to a positive outcome. For a lot of people, there can be quite a negative turning point, which then eventually leads to something positive. What advice would you give to the listeners that are going through a turning point? And what would you kind of advise them?
What a great question. There have been so many incidences in my life where things haven't gone as planned. There was one job where I was told that I'd be relocating to the States, and the visa was all underway, and we had put up our house, and my husband had quit his job, and we were ready to move. We told all our friends, we had farewell parties, all of that, and then I been made redundant for that job, and it kind of left me in a very awkward place, of course, and many other such incidents. So I've had plenty of setbacks. This is the first one that comes to mind, and so when you're in it, it's very difficult, and we're in a very difficult, economically challenging macro environment right now. The job markets are very difficult, and so when you're in it and when you're facing that setback, it's really easy to turn inwards and think it has something to do with you. While self-reflection and self-awareness is important, the important thing to know is that know what your strengths are and play to your strengths. Make choices that will showcase your strengths and enhance them. Everyone has development needs, weakness areas, whatever you want to call it. But if we lead with the strength that has the ability to show what we can bring to the table and seek partnerships where there are known areas of not being strong, and seek those kind of partnerships, seek those kinds of collaborations where people bring something to the table where the sum is greater than its parts. So it's so easy in a negative space to think it's all you. Sometimes it's not all you, and each day allows for a reset. Each day allows an opportunity to look at, okay, so what am I going to do differently, or how am I going to play to my strengths today? That's something that I would say has it's not been consistent. The every day is not the same, but just trying to remember. And I remember someone told me, why don't you write down your strengths and put it on the wall in front of you so you know it's there to see? Because when the going is bad, our monkey mind, as I tell my daughter, it has a tendency to hold on to the negative stuff. We forget the value that we add in the world. We forget our uniqueness in the world, and so it's really important to have that reminder, whether visual or something that you can go back to and remind yourself there's a lot of strength, there's a lot of goodness in there.
Feels like there's so many lessons and takeaways from what you've shared. I love the idea of having a personal board. I've never actually heard that, but I'm trying to sit here and think who's on my board at the moment. Who do I go to for that feedback? Because it's based on that feedback and what you know about yourself that you can work out what those strengths are. So this will inevitably have shaped you as a key opinion leader, a leader of people within Thermo Fisher, a mentor to others, and as you just alluded to there, a parent. So what sort of softer skills have you learned through all of this that make you who you are today?
The biggest skill I developed through my leadership was empathy. Whether it's empathy for my colleagues who are in the functions that are not the same as I. So I've had a mentor who's the financial officer in the business. Had a mentor who's from sales, from the commercial organization. talking to people has really given me insight on what their pressures are. So what happens to them when we say no, in regulatory? How do I craft my messages so that there can be a win-win here if that's possible? If there is a no, how do I help them navigate that situation that puts them in a difficult spot? I may be not able to change the outcome, but at least I can be human there and helping them navigate through options or alternatives or a greater understanding of where I'm coming from. And so being that partner, I'd say that in today's day and age, with so much going on in the world and so much of negative news dominating all of the media we consume, so important to remember that we're all humans. We all want to succeed. We're all the heroes in our own stories. And, where nobody's waking up here and trying to make someone else's day miserable. But really, how do we do that with each other? So whether it's at in my professional life, or it's on a personal note, for me, that's a very key skill to develop, to be a better regulatory business partner, to be a good life partner, to be the person you want to be in the roles that one plays in life.
You've actually brought me on to my next question, was where do you see yourself going here personally and professionally? So it sounds like you've reflected on that already, but do you set goals? Do you look too far ahead into the future?
I set some goals on an annual basis. I don't look too far into the future. This is because I've been, in this career journey. I've found I've navigated myself to, what was visible, what was to my eye, what was visible in terms of possibility, whether we call it, external engagements, whether it is interactions with regulators, it is holding a position in a company of the size I am right now. So a lot of those things were things that, I would have aspired to, say, 10 years ago. Now, especially after the pandemic, I'm a lot more feeling inclined towards following my curiosity wherever that leads me. There's something in the future about, better access of diagnostics, medical devices, and such to people. Innovation doesn't have to be the next big machine that, that does the unthinkable. It could be something very small, but have great reach, have a much better impact on a person's quality of life, very accessible. Maybe somewhere in that direction. I don't have a roadmap yet, but I think I know where I'd like to go at some point in my future.
Okay. And talking about the industry that we've been fortunate enough to recruit in for the past 12 years, and you've worked in longer than that, but looking at the future, what most excites you about this industry?
The conversations around inclusivity and inclusivity is such a moral obligation. It's like a scientific imperative, right? It's about having sufficient and right data points to tell us what therapies, what devices, what diagnostics works across populations. And how does it serve the needs of people the best? So it's not just about focusing on minority or rare diseases or anything of that. It's about thinking about, thinking more widely around whom can this impact in a positive way? Have I factored in their way of using this product? What could be better for them? So thinking about the various users, thinking about how they might use it, thinking about what's true for them in life and how it might be effective for them. So whether that's, as a health equity, or whether that comes out as inclusivity in trials, in design, or whether that sort of comes out as real world evidence. To me, looking at the real people that use it, will use the technology, the product on a day-to-day basis, and what we can glean from that and make advancements in making that better and better, that feels very exciting. That shift from very lab based, bench based to what's real and what could be the best representative of how something might perform.
So there's been a lot of reflections throughout this conversation, but if you had to summarize one key lesson, one key takeaway for the audience based on your life, through your experience, what would you say?
Feedback is great. Not all feedback is relevant. They're not all applicable at the same time. Know your strengths.
Very good.
Good.
Well, a big thank you for joining us today. I personally found it very useful, and I'd like to echo Duncan, well, your point, but what Duncan had mentioned around the board of directors and who do you have on your board. I've never heard that before, and I think that could definitely play a part in a lot of people's lives. And
Can you, just on that point, can you sack people on your personal board? Is that possible?
Well, they finished their term, and
Okay. Yeah.
it's a great question. And sometimes you don't have those intense interactions, so you think about what serves you at that point of your time, what you need to hear, what conversations are important. You stay friends with them lifelong, but maybe the intensity of the interactions with them chops and changes over time, and that gives them a break from you as well.
And for the listeners at home, thank you for tuning in. And if this episode has made you reflect on your own turning point and you'd feel comfortable sharing it, it could be a positive turning point, a negative turning point, whatever that may be, reach out. We'd love to have you on. And don't forget to like, subscribe, share, all of the usual stuff. And we look forward to bringing you our next guest on Beyond the Device.
Thank you
Thank
very
you so
much.
much for all the questions. It's been really fantastic. The experience has been excellent. The prep was top notch. Thank you.
Thank you very much.
Right.